Hi everyone, my name is Carrie Cusson and welcome to Nurturing Your Infant and Yourself, this 6-week online virtual workshop journey that we're going to be taking together. So I want to tell you a little bit about myself since this is like our first meeting essentially. I am a licensed clinical social worker and experienced yoga teacher, which means I've just been teaching for a certain amount of time and I've logged a certain amount of hours. So I get to say that I'm an experienced teacher now, which is pretty exciting for me. And in my social work experience over about the last 8 years or so, I have worked with children and families in many different capacities, ranging from individual clients to family therapy, to therapeutic mentoring, to in-home therapy, to, early intervention, lots of different types of services, but they were all kind of wrapped around working with the family unit. So in early intervention, I was working as essentially a case manager or families that I would visit on a weekly basis and work with on a variety of different developmental skills and needs. And so during that time, I also ran parent groups and parent and infant groups. And I also received my prenatal and postnatal yoga teaching certificates. So I was able to work with women in the perinatal period really closely during that time. And still to this day, I teach prenatal and postnatal yoga classes as well. So the expectations for this group or for this workshop series that I'd like to set today on this first class, I guess you could call it, are just to be open with the information, to be kind to yourself, and to be patient while learning, both during this workshop period, learning this new information, and then also learning about your new baby. So this realm of having a new baby, just like in life, right? There's no manual. So what I am offering you, whether it's some sort of tip or advice or information, know that I am hoping just to plant seeds, and I'm hoping that I do not create a longer to-do list for you in any way. But my intention is to really provide skills and strategies that are proven and are effective. So with that said, these skills and strategies might not be exactly how you roll in life, and that's okay. We'll talk a lot about mindfulness strategies for stress relief. And so if this is something brand new to you, I again just ask you to be open to it and give it your best shot. You never know if something is going to be helpful until you try. So over the next 6 weeks, we're going to be covering topics like stress relief, self-care, developmental activities that you can do with your infant, bonding and attachment, what else? Community resources. So especially during this time, during this nationwide or global pandemic that we are all experiencing, this is all new territory for us too. So we have to remember to kind of take that step back and not get anxious about not knowing, because we all don't know a lot of things right now. And again, that kind of goes to speak to how we experience an infant, right? Bringing a new infant into our family, into our homes, into our life. There's a lot that we don't know. So this is a really big learning period. And during this time, you might be experiencing more isolation than usual because of the pandemic. And so we'll talk about strategies on connecting with other people, your family, your friends, and your community. So I think that's all I wanted to say for this welcome. So we'll dive in now to today's topic, which is the fourth trimester. Well, let's talk specifically about emotional shifts and changes during this fourth trimester time. So perinatal emotional complications is a broader term to encompass a lot of what new caregivers can be experiencing during this time. And that also includes fathers during this period as well, which we'll talk about a little bit more. Perinatal emotional complications don't just revolve around postpartum depression. It encompasses more emotions than that, but that's kind of that misconception that that's the only feeling that mom will get after baby. And there is that period of baby blues, which mom may experience soon after baby's born. And it's normal to experience episodes of sadness, heightened emotionality, tearfulness, doubt, irritability, concern, and fear. And nearly 85% of women do experience these feelings. And in between all of that, there can be moments of joy and happiness. The body is also recovering from pregnancy and labor, and childbirth. And so, right, new mothers are not getting much sleep. Hormones are adjusting to being non-pregnant and maybe non-lactating levels. So this period of baby blues is transient. It's not something that sticks around for too long. Typically, symptoms will not persist all day, every day. And for many, the blues peak around day 3 to 5 postpartum due to those hormonal shifts. And in the span of a few days, if mom gets a nap, a shower, a good meal, or a friendly visit, she is likely to feel better. In a few more weeks, her body will be healed. Maybe a breastfeeding routine will be more established at that time, if that is what mom is choosing to do. And these slow adaptations to new life will be developing during this time. So time and rest are usually the cure for baby blues, but if symptoms persist, it's definitely worth checking in with a professional provider, whether that's your midwife or OBGYN or a professional therapist. So these other emotional complications that I just mentioned might look like sadness, crying, feeling hopeless, or like things are never going to get better, anger or rage, or having a really low frustration tolerance, having a lack of appetite, not participating in the care of baby because of these feelings and emotions, and just extreme physical fatigue, feeling isolated, persistent and overwhelming or disruptive concerns or worries are pretty common. Particularly around the baby's well-being. So always wanting to check on baby and make sure that they're okay, which is completely a normal instinct, but there's kind of a threshold where that type of behavior can become more intrusive and not so helpful. Consistent inability to sleep when you have the chance to sleep. Statements about wishing we could just escape from this life, and any other intrusive thoughts. And so it's important to talk about this because nearly 1 in 5 women will experience perinatal emotional complications, which not only affect her health, but the whole family system. So While they are very treatable, when left unaddressed, these perinatal emotional complications can worsen. And so, like I said, talking with a professional, someone on your team, someone that you trust, is going to be really important during this time. So who is at risk for emotional complications? Well, mothers, of course. Any woman bringing a new baby into her home, whether it's the first time or the fifth time, will face tremendous change. Any woman can experience these perinatal emotional complications at any point. However, there are some factors that can heighten those risks, such as a history of mood or anxiety disorder, family history of perinatal depression or anxiety, history of trauma, history of substance abuse or addiction, financial stress and distress, experiencing racism or discrimination, major life stress, including loss of a job or a recent move, persistent lack of sleep, social isolation or lacking community support, and having a traumatic birth or extenuating circumstances around the birth, including just the perception of a traumatic birth or having a really difficult birth can impact how a woman is experiencing these complications. So other risk factors might be having twins or multiple births, concerns around the baby's health or well-being. So if you have a baby born premature or needing to stay in the NICU, that can heighten these risks for emotional complications. History of infertility or previous miscarriages or losses. Difficulty breastfeeding. Relationship problems or lack of support from the partner. And type A or perfectionist personalities can also heighten these risks for emotional complications. And so new parents anticipate, of course, having little sleep and experiencing a major life change. So lack of sleep, adjustment to a new life, and breastfeeding challenges are all really normal occurrences that increase the risk of emotional complications. Yet because they're normal, their impact is often minimized. So we don't talk about how these shifts and changes in a mother's life or a new father's life can really impact their emotional well-being, right? They're just kind of these expected changes that aren't really talked about or have a lot of support surrounding, like how do we deal with these changes and how do we get support around them. So who else can experience emotional complications is fathers, of course, as well. And so it's really important to note that fathers are at risk for a perinatal emotional complication too. Up to 1 in 10 new fathers experience paternal postpartum depression, and rates are highest in 3 to 6 months after birth. But research on fathers' experiences of emotional complications is really sparse, and what has been done focuses mostly on men paired with women. And so in men, postpartum emotional complications often present as increased irritability, frustration, anger, jealousy, fatigue, isolation, insomnia, overworking, and maybe even substance abuse. So the primary risk factor for emotional complications in fathers is their partner's postpartum emotional complications or postpartum depression specifically. So this means that in families where mom is diagnosed with postpartum depression, then the father is more likely to experience feelings of depression as well. It doesn't mean that one is always causing the other, but it's important to understand that if mom is having a hard time, that it's really likely that dad is going to be having a challenging time as well. So the fourth trimester is the period after a baby is born to about 3 months of age. And so we've all heard of the first, second, and third trimesters, but the fourth trimester is something that isn't talked about, in my opinion, enough. So the fourth trimester is considered this stage in which the baby is kind of like a fetus in the outside world, completely and utterly reliant on its caregivers. So Dr. Harvey Karp is the one that coined this idea or this term of the fourth trimester. So when you think about other creatures and other animals having babies and the infancy stage of these babies, it's really different than human beings. So whenever I talk about this example, I always think about maybe like a giraffe or a baby cow or a goat or something like that, something with 4 legs, right? And so you can imagine this experience of this animal being born, and then, a few minutes later, they're walking around wobbly at best on their skinny little legs, but they're already, I don't even know how many times more self-sufficient than a human infant after birth. So this first year, essentially, of a new baby is a time of growth, like really rapid growth for both caregivers and for baby. But especially, again, these first 3 months when they're really reliant on their caregivers, this period being the fourth trimester is an especially important period just to kind of allow yourself to learn new skills, to learn about your baby, to learn about yourself. So I have lots of different notes here and resources, and I've tried to gather the best resources that I can for you. So you're going to see me kind of reaching and grabbing around at all my different papers. And how can we prevent postpartum depression? So these strategies would be, again, more preventative. So if you're experiencing any of these symptoms or feelings right now, some of these strategies might not apply to you in this moment. However, you might get creative in thinking of how to incorporate them now in the stage that you are in. So creating your kind of like modern day mini village with the aim of getting more sleep is going to be essential, but also really challenging again during this time of the pandemic. So if you have the opportunity to invite in healthy family members or friends, that might be an option for you. If you have kind of gone through the quarantine recommendations and you can invite someone into your home to stay for a longer period of time during this fourth trimester, that might be really helpful for you as well. We can also start to lean more on technology, FaceTiming, talking on the phone, really having human interactions voice to voice rather than just through text. We can also lean on technology for baby's sake, for having nice sounds for them that will mimic the sounds in the womb. And then also doing everything that you can to keep baby safe so that you have a greater peace of mind. So staying away from bulky bedding and things in the crib, or just starting to know what are the triggers for you that would cause a lack of peace of mind or take your peace of mind away, and try to alleviate that by finding little shifts. You have to identify the problem first to then make any changes afterwards. So if you're really not liking when your baby is playing with a certain toy, maybe that certain toy just kind of goes away for now to give you greater peace of mind. Again, this is really challenging during this time because the normal recommendations would be to invite friends to stop by, to have a chat or to help you with some chores or to bring over some meals. So we might have to get more creative during this time There's lots of delivery services I know, or if your friends can still make you a nice homemade meal and drop it off at your porch, so that you don't have to worry about that aspect of your daily routine. That can be really helpful. Learning the 5 S's, like I said we would cover. The 5 S's by Dr. Harvey Karp. And I'll put a little infographic after I explain these 5 S's so you can see them as well. So the first S is swaddle. Swaddling recreates the snug packaging inside of the womb and is the cornerstone of calming. So it decreases startling and increases sleep. A wrapped baby can also respond better to the rest of the 4 S's that we'll cover in a moment. And it'll help them to stay soothed longer because their arms can't really wriggle around. And so just to note that babies shouldn't be swaddled all day long, but just during those fussy times and during sleep. So number 2, the second S, is side or stomach position. The back is the only safe position for sleeping, but it's the worst position for calming fussiness. So this S can be activated by holding a baby on his or her side, on his or her stomach, or over your shoulder. And so you might see your baby mellow a little bit quicker rather than trying to place them on their back with that face-to-face contact. That just might be a really uncomfortable position for them to be in. And so there's something called a tiger hold, where you allow baby's stomach to kind of drape over your arm, in which you can rock them side to side or back and forth with support of the head while they're lying on their stomach on your forearm when they're little enough to do that. So the third S is shush. So contrary to myth, babies don't need total silence to sleep, and this is something that I've learned in the last few years when friends and family of mine are having babies. They're putting on music, they're vacuuming, they're letting the dogs bark, they're just allowing life to happen because baby during this time, during the 4th trimester and even beyond, is going to be sleeping during daytime hours when life is happening. And so in the womb, the sound of blood flow is a shush, louder than a vacuum cleaner. So not all white noise, though, is created equally. Hissy fans and ocean sounds often fail because they lack the womb's rumbly quality. And the best way to imitate these magic sounds is white noise. So the 4th S is swing. Life in the womb is very jiggly. You can imagine the baby bopping around in mom's belly when she goes up and down stairs or just kind of moving around her day. So slow rocking is fine for keeping quiet babies calm, but we can use kind of faster motions. You can imagine a baby over your shoulder and just kind of bouncing gently while supporting the head and the neck, and finding that movement. Your baby's going to tell you whether he or she likes it or not. So we can try lots of different types of movement for them, but this kind of swinging or up and down motion for them can be soothing in its own way. And so finally, the 5th S is suck. So sucking is the icing on the cake for calming. So many fussy babies relax into a deep tranquility when they suck, and a lot of babies may feel calmer with a pacifier. This idea of a pacifier might be worrisome for some parents. I know personally that a lot of my family and friends have kind of grappled with, do I use a pacifier? When do I take it away from them? They're gonna, their teeth are gonna be messed up, or they're gonna have other issues because they've used the pacifier. So during this period, like I said, there's no manual, and there are lots of tools that you can call upon I think the best tool that you have as a new parent is your intuition and your ability to get to know your baby at a deeper level than anyone else can. So sometimes you might have to kind of go back on a rule you might have set. If you said, we're never going to use pacifiers, this again is a period of exploration and learning, and so you may have to amend the rules that you've set for yourself or for your baby, just to make sure that everyone's well-being is at the forefront for you. And so you might have to use that pacifier even if you didn't want to, or you may consider co-sleeping even though you never imagined you would. Again, this is a time of getting to know yourself and your baby, and being flexible during this time. So I think that sums up the 4th trimester for today. And so before we go today, I'd like to offer a really simple mindfulness strategy to relieve stress and bring you back into the present moment, because we know that a lot of our thoughts about the past or the future kind of take us away from being present and being here with what is right now in the moment. Lots of worries about the future, or we might even ruminate about the past, things that have already happened. Again, they take us out of this present moment, which we know impacts our level of happiness and our level of well-being. So the more present we are, the more well we can feel. So start to just shrug your shoulders up and down, your back a few times, maybe even stretch through your neck a little bit. Release some of that tension, release some of the weight that you're holding on your shoulders. And if you're holding your baby now, or if you're by yourself, either way, just notice the simple fact of breathing, of your breathing, of your baby breathing. Okay, this process that we don't really think about, but it's giving us life quite literally all day, every day. Our breath is happening in the moment now. So if you're comfortable enough to do so, you can close your eyes or just drop your gaze low towards the floor. And allow yourself to take 3 mindful, deep breaths. Breathing in and out of your nose, allowing your lungs to fill as you inhale. And try your best to release all of that air as you exhale. If your eyes are closed, you can open them back up here. So just stopping throughout your day as many times as you need to take a few deep breaths. Could be that reset that you might need in that moment. So use that strategy as often as you need to. And so I will see you again next week for our next video of this Nurturing Your Infant and Yourself series. I hope you enjoyed this first time together, or our first time together today, and I will see you again very soon. Thanks for joining.